My advice for moving forward with this surgery would be, one, I think you need to be mentally prepared for it. Decide that, yes, I need to do the surgery. It's very, I mean, I did it for a long time and said, it's going to get better. I'm young. I'm going to do physical therapy. I'm going to do acupuncture. I'm going to do everything that I can possibly think of, and it's going to go away. And it just didn't. And so for me, I finally hit the point that I realized with the pain level and lack of mobility that it had to be done, and it was time to be done. So within myself, I realized it was time, and I think that's important. And however, I would recommend this in a heartbeat, just to reflect on the pain that I was in. You just don't have to go through that. You don't have to go through it. And just the process of how smoothly it goes, how fast you really do heal, and how you can feel 100%, because I feel 100%. You know, in 6 months is amazing. And not that I didn't feel 100% 5 months ago, but because we're speaking today, I would do it again in a heartbeat. I hope I don't have to, but I would do it in a heartbeat. I would do both at the same time if I had to, but I would not stay at that point of pain any longer than you have to, because it's not necessary. I think the pre-op class was phenomenal, just top rate, top notch, and every doctor should do it. I brought my husband along with me, and it was a 2-hour class. They went from, Jerry was in there going from beginning to end, everything to expect. There were no surprises. It was absolutely excellent. The physical therapist was in there as well. They had the pieces that were actually going to be, you know, that the doctor was going to put in. And it was just very helpful to see how they maneuver, they operate together. They talked about every possible pain that you would feel. I can't stress enough that they covered everything. I just did not have any surprises whatsoever, which I felt was just, it's just something you don't want to have after you go through a surgery. And especially for me, it was a first surgery, so it was, you know, I was of course a little bit nervous, but I felt very safe. I felt very comfortable. I felt they're very personable, very professional. It was really quite good. The anesthesia process was something new to me, and really went better than I had ever expected. Again, when the procedure started at 7 a.m., I didn't even realize when it actually happened. We were just having conversation, and the next thing I knew, I woke up at 10 with Dr. Dorr, my husband, chatting with me. I was a little bit, I was clear I could see them at, you know, at 10, and I understood who they were, and the surgery was done, and I was quite surprised that it was just a couple hours ago. It was so fast, because I do remember looking at the clock at 7 a.m. and looking at the clock again at 10:15. So when I went upstairs, I felt very, very comfortable, a little bit, not too hazy. In fact, at noon, I remember I called my girlfriend. It was her 40th birthday, and I was missing her birthday, so I picked up the phone and called her, so I must have been feeling pretty good at that point in time. And I just remember feeling a little like I needed dehydrated. I needed fluids, which they kept pumping into me, so that was really wonderful. And sometimes if I didn't have enough, if I felt too dehydrated, it made me a little lightheaded. But again, they just gave me the fluids. When I was ready to stand up, I stood up and was feeling really good. I didn't get sick. I don't recall getting sick at all. I recall one time, just at the end, getting the shivers, which I guess happens with the anesthesia. And I got suddenly cold. It lasted about 5-10 seconds, and that was it. After the surgery, they took me up to the 6th floor into a very nice room, I must say. It felt like a fine hotel up there. Great service, very professional. Anyways, I was sitting in my bed for a while, and after, you know, being hydrated in a couple hours, the physical therapist came in. They actually came in, I believe, 2 or 3 times that day. And the first time they had me just kind of swing my legs up and stand up with a walker and just kind of move back and forth in the room, back and forth, back and forth. And then when it was a point that, you know, I felt like I had enough, I sat back down, laid back in the bed. They came back in again, and she took me down the hallway, I think the next time. It's down the hallway, and with a walker. And then we went with the crutches. And we also went with the crutches down the hallway, walking down the hallway and learning how to walk with the crutches. And then up to the stacked stairs. I believe it was about 3 or 4 stairs that we learned to walk up with the crutches and to walk down, and then back to the room. I believe that, again, that happened like 2 or 3 times. And then there was another lady that came in therapist that came in and basically told you how, helped you put on your clothes. So we had to, learn to sit down or sit and kind of reach down and pull your pajama bottoms on, and put your shoes on, tie your shoes, and sit back up. So we learned to go to the restroom, and the whole thing, just a lot of the function that you'd be able to move, so when you get home you felt comfortable. To go home and to be able to go into your routine, if you will, and obviously you're healing, but it was wonderful. It wasn't a problem at all to pet my dog, or to go to the restroom, or you're just cautious. You use the precautions that they suggest for you, and you're fine. I'd like to say, if you are fit, you feel that you could handle the surgery in one day. If the doctor and the staff feel that you can do the surgery, it's definitely a way to go. I highly recommend it. It's wonderful to come in the morning and leave that later in that evening and go home into your home and be with your family and your friends in your comfort zone. It's a great thing to do, and again, I would highly recommend it if you're recommended as a candidate for this surgery.